Hello class, today we will be reviewing a family health assessment. This is to prelude your clinical rotation where you will have the opportunity to see a family health assessment firsthand. When assessing the family, we must look at what the family is like, who is considered a part of the family, what is the patient's position and the role within the family, who has the most influence on the patient, what are the ages and sexes of each of the family members and what are their occupations. What is the health status of the family members? And are there physical limitations that might affect the family member's ability to help with care when needed? When assessing the family, we must look at what resources are also available to them. Can the family provide for patients' physical needs? What's the patient's home like? Does it have sufficient safety and comfort features? What is the patient's ability to perform self-care? Do they need an aide at home? What are the insurance resources? What's the neighborhood or community resources available? Is there Meals on Wheels or any church services? And what organizations does the family have with friends, neighbors, churches, and communities that will help in the assistance of taking care of their loved one? When looking at backgrounds, lifestyles, and beliefs, we need to look at the level of education of the family members and their attitudes towards learning. Do all the family members have basic literary skills? Are there language barriers to the verbal communication? And what are the family's lifestyles and cultural background? Do they come from another country? Does the family have any folk medicine beliefs? Are there any potential conflicts between cultural beliefs and the recommendations of the health professionals? What are the family's normal dietary patterns? Is it high in sodium? Does the family seem to be able to take in new information easily and apply what is taught? Or does the family seem overwhelmed as a result of needing to learn a new skill? Another important aspect to consider when assessing the family is how well do they function together. Do family members seem to be sensitive to one another and support each other? Do the family members appear to be able to communicate effectively, or are they constantly yelling at each other? Does the family indicate that they have the ability to accept help from others when it is needed? And how open does the family seem to teaching? Do they seem resistant to the ways that you're trying to teach them? Do key family members have the ability to make effective decisions? And what experience does the family have in handling crisis situations, like a teenage child going into hypoglycemic episodes? And what did the family do when they reacted to the crisis in the past, and what resources have they used to help them? When assessing a family, it's important to assess the family's understanding of the current healthcare problem. What do they think caused the healthcare problem? Is it something in the water? Is it something they believe spiritually? And why do they think the problem may have occurred again? What do they think of the illness in relation to the patient? How severe do they believe that the illness actually is? What kind of treatment is the family looking for? Is it a curative approach, or is it something where they're just looking for a temporary fix? What kind of treatment do they think the patient should receive, or should they not receive treatment? What are the major problems of the illness that the illness has caused for the family? Is there underlying angst and anger? And what do they fear most about the situation? It's important to assess all these aspects. Another important component in the assessment of the family is what are the patient and family teaching needs. What do the patient and family think are most important in regards to what they need to know? Do the patient and family know others with the same healthcare problem, and are those people reliable sources? Do the patient and family understand and agree with the treatment plan, or are they going to deviate? Are there any physical or cognitive limitations that will be barriers to the learning? Are the family and patient willing to negotiate goals with the healthcare team? Are the patient's perceptions about what to do similar to the family's point of view, or are they differing? A good family assessment requires astute observation skills and the ability to be an active listener. Assessment data can be obtained anytime a nurse interacts with a patient or family. Gathering information about family structure, function, and needs does not have to be restricted to structured interviews. Anytime the family is present, you can obtain more information about their family and the role in the patient's healthcare management. Informal conversations with both the patient and family while you're doing routine care can yield data that will help you complete the family picture. Learning to answer the questions reviewed will help you immensely in developing an effective teaching learning partnership with the patient and the family.